Hello, today I will be discussing an ongoing study topic, which is the role of physiotherapy in management and prevention of lower back pain. Before I go into details, I just want to say that this is a very common issue that almost everyone can relate to. Lower back pain is basically discomfort or pain in the lower part of the spine, and it can be mild, like just stiffness, or it can be severe enough to affect daily activities. The reason this topic is important is because it is not limited to a specific group of people. It affects students, working professionals, and most commonly in older individuals. And in today's lifestyle, I feel like it's becoming even more common, especially for students like us who spend long hours sitting, studying, or using mobile phones. This is something very relevant to us, especially me as well. So, in this discussion, I will be talking about how low back pain happens, why it is increasing, and most importantly, how physiotherapy and we as a physiotherapist student can help in managing and preventing it. So, according to research studies, a large percentage of people experience lower back pain at least once in their lifetime. And if you think practically, it's not surprising because our daily routine itself includes many activities that can put stress on the lower back. For example, if I talk about students, or even in our universities, they sit for a long time and we like basically sit for a long time during our class sessions. Uh, and even during breaks, we are usually on our phones, and most of the time, we are not even sitting properly. Sometimes we are slouching, sometimes leaning forward, sometimes lying in the bed with awkward posture. All these positions may feel uncomfortable, uh, but it is a habit, right? But at the end of the day, they are not actually good for the spine. Over time, these small habits start creating pressure on the lower back. Similarly, if we consider working professionals, they often sit in the front of computers for many hours continuously. So, if the workstation is not properly adjusted, like if the chair height is wrong or the screen is not at the eye level, it can affect posture in a negative way. And when posture is not correct, the muscle of the back have to work harder to support the body. This leads to fatigue, stiffness, and eventually pain. On the other hand, even people who are physically active can develop low back pain. For example, if someone lifts heavy objects without proper lifting techniques, or if they even make sudden movements, it can cause strain or injury to the back muscles basically. So we should understand from this that low back pain is not caused by just one factor. It is usually a combination of habits, posture, and lifestyle. Another important thing is that people often ignore early symptoms. They might feel slight discomfort, but they don't think it's serious. And because of that, they continue the same habits, which makes the condition worse over time. So, in my opinion, low back pain is largely a lifestyle related problem. It is not just something that happens suddenly, but something that develops gradually due to daily habits. Uh, One of the main reasons is I think it is because of lack of awareness in people. People either don't know about correct posture, or even if they know, they don't follow it consistently, like us. So, even we as a student, knowing that sitting straight is important, in reality we don't maintain it for long. Another major factor is lack of physical activity. Nowadays most of people have a sedentary lifestyle. We sit more and move less, and when the body is not active, muscles become weak, especially the core muscles, which are very important for supporting the spine. I also feel that people depend too much on temporary solutions. For example, if someone has a back pain, they what they usually do is they might take a painkiller, and once the pain reduces, they think the problem is solved. But actually, the root cause is still there, and why the pain comes and basically that is why the pain comes back. It doesn't go away permanently. So I think the focus should be more on prevention rather than this treatment. Even simple habits like maintaining posture, taking breaks, stretching, and doing basic exercises can make a big difference. And if these habits are followed regularly, many cases of lower back pain can actually be avoided. Now, coming to the role of physiotherapy, physiotherapy plays an important role in both managing and preventing lower back pain. It does not just reduce the pain temporarily but helps in long term improvement. One of the most important components of physiotherapy is exercise therapy. This is basically this includes stretching and strengthening exercises. Stretching helps in reducing muscle tightness and improving flexibility. For example, if the muscle around the lower back are tight, stretching can help relieve that stiffness. On the other hand, strengthening exercises, especially for the core muscles, help in providing support to the spine. So, core muscles include basically two muscles in our body, and they are core. They are like core muscles, our near around our stomach and our back muscles. They play a key role in maintaining posture as they are active most of the time while we are sitting or crouching. If these muscles are strong, the load on the spine is reduced. This means they use their hands to move away joints and muscles in a controlled way. This helps in improving movement and reducing pain. In some cases, additional methods like heat therapy may be used. Heat helps in relaxing muscle and improving blood flow. And another very important part of physiotherapy is patient education. Patients are taught how to sit properly, how to stand properly, and how to perform daily activities like simple lifting of groceries safely. They are also guided about what movements to avoid and what not to. Research studies have shown that physiotherapy is effective in reducing pain and improving daily function. So it helps in preventing the condition from becoming chronic. And if exercises are continued regularly, it reduces the chance of the pain coming back. So overall, physiotherapy is not just a treatment method, it is also a preventive approach. So to conclude, low back pain is very common condition, but it is also manageable and preventable. It is mainly caused by factors such as poor posture, lack of physical activity, and improper habits. It can also be caused due to a prolonged lifting of something or simple but serious things like injuries or disability or deformity of the spine. So basically it can be happening due to many reasons, and I think one of the most common reason has to be because of the old age. People of the old age complain very much about back pain, knee pain, and so on, but mostly it is back pain because as people get above a certain age criteria, the muscles and the bones, they start getting weaker and weaker. And if there is not physical activity involved in their daily life, it becomes even weaker and the muscle shrinks, known as muscle atrophy in physiotherapy terms. So physiotherapy hence plays a very important role in addressing this issue because we can help patients to strengthen their muscle and rehabilitate them in different ways. So through exercises, for example, we can suggest different type of exercises to the patient to help them uh, improve their condition of back pain, and also suggest them different types of movement techniques. And another technique we can use is manual therapy, where heat or cold is applied, as I've already talked about. And education. The most important thing is posture education to the students. So, I, as a physiotherapy student, think that patients should be properly educated about posture and how to maintain it so they can avoid it. And if they already have it, they can improve it as well. So, in short, exercise is manual therapy and education. It helps in reducing pain and improve quality of life. I believe that most important factor is awareness. So awareness is the key. If people understand the importance of posture and physical activity, many cases of lower back pain can be prevented. So, instead of ignoring the problem, it is better to take early actions and focus on healthy habits. So, at last, I would like to suggest everyone to maintain proper posture and follow exercises and maintain an active, healthy lifestyle to avoid back pain in the near future. Thank you.